All right, this video is to cover the organisms in the genus Campylobacter. Most specifically, we're going to focus on the organism C. jejuni, as it's kind of the most common and important organism of this genus. But there are also three other organisms that people consistently think about: C. coli, C. fatis, and C. oopsaliensis, which is a little bit of a tongue twister. But as I mentioned, C. jejuni is kind of the most important pathogen. There are actually 33 species within the Campylobacter genus. Most importantly, obviously, C. jejuni. So the Campylobacter are kind of spiral-shaped organisms. So in some of the earlier videos, I basically talked about the three shapes that you might encounter in bacteria. You've got your cocci, which are basically little spheres. You've got your rods, which are bacilli. And then you've got your spirals, which are like your spirochetes, like Borrelia. But these are kind of a hybrid of your bacillus and your spirochetes, because they're kind of comma shaped. They're like kind of smaller spirochetes, and you can see that here. They're fairly small, so they're not quite all the way comma shaped, like say a Vibrio, but they're smaller spirochetes of them. These are kind of a unique organism from their oxygen requirements. They're microaerophilic, so they need a little bit of oxygen because they're unable to ferment or oxidize carbohydrates. So they do need oxygen in order to perform respiration, but they don't need very much, which makes them a pretty hardy organism because they can survive in areas where other organisms that would require a lot more oxygen can't. Technically, these are considered small motile gram-negative rods, and they're actually really, really small. They are technically filterable, which is typically something that we reserve for viruses to give you kind of an idea of how small they are. And they can fit through a 0.45 micrometer filter, while other bacteria would certainly be withheld by that. And that actually is something that you could theoretically do to isolate them for culture. In fact, when people were first trying to identify the causative agent of this particular disease, they actually were looking for a virus because they kept filtering and they weren't coming up with anything. So that's how small this organism is. It's kind of a unique quirk about C. jejuni, but thankfully we do not spend the majority of our time in labs filtering feces. So that's not something that's commonly done, but you can do this. If you're looking at an older colony, the organism might look more rod-like than spiral-like. Just as the organism ages, it can take on a different morphology. So the other thing that kind of delayed the identification of Campylobacter jejuni, besides its small size, was actually this microaerophilic property it has. Most of the time when we are culturing things to grow out bacteria, we are keeping them at about 5 to 7% CO2, at about 37 degrees Celsius. And this organism wasn't really growing. It really requires lower oxygen. So in order to isolate Campylobacter jejuni, you almost want like 10% CO2. And so when they were culturing, they weren't getting anything. It also grows best at 42 degrees Celsius, not 37. So it's kind of a special snowflake in that way. So since it has all these special requirements, it really wasn't identified early. And they're actually pretty slow growing as well. They can take up to 2 days to begin really getting a good culture of C. jejuni going. It is a gram-negative organism, so it has a gram-negative cell wall structure with an outer polysaccharide capsule. But instead of LPS with endotoxin-like activity, it has these things called LOSs, lipo-oligosaccharides. Oligosaccharides. Oh, look at that. There should be a G here. Oligosaccharides. That's why that looks funny. The capsular polysaccharide is actually a major virulence factor for the C. jejuni, and you're still going to get an inflammatory response to the LOS the same way you would to LPS. It's just its own special version. So as you can tell, there's kind of a lot of special things about C. jejuni. So the main reservoir for C. jejuni is actually the gastrointestinal tract of animals, any animals. So this is also a zoonotic organism. And the one we think of the most actually is poultry, chickens, turkeys, things like that. But it can also be found in contaminated milk and water. So the way you actually wind up contracting C. jejuni is that fecal oral route. That's actually our most common exposure to this organism. So since it's acquired via the fecal oral route and it has such low oxygen requirements, it's no surprise that one of the main things it does is cause gastrointestinal infections. So in this case, we're talking about typically an acute enteritis, maybe an acute colitis. The symptoms can actually mimic a little bit appendicitis. So you wind up with like severe abdominal pain, which is how it actually can occasionally mimic appendicitis, because obviously patients with appendicitis have that abdominal pain. Patient can have 10 or more bowel movements during the day during peak of disease. Stool will be bloody typically. It does have that kind of bonus, and if you were to examine the stool. Thankfully, the disease is generally pretty self-limited, maybe a week, maybe longer, but it's not something that normally requires much medical intervention, really just supportive care, making sure that the patient has enough fluids, things like that. I mentioned earlier that it has, these adhesins and cytotoxic enzymes and enterotoxins, but we don't really know what role they actually play in disease, just that it produces these types of diseases. Gastrointestinal disease is the most common, and you'll actually see the histologic damage to the mucosal surfaces of the jejunum, certainly, but also in the ileum and the colon as well. So it can kind of work the entire gastrointestinal tract. In the case of Campylobacter, what you'll see is that the mucosal surfaces will actually appear a little ulcerated and edematous and bloody with the crypt abscesses and epithelial glands and infiltration of the lamina propria with neutrophils, mononuclear cells, eosinophils. So that tells you it's also pretty inflammatory. And we see that when we look at gross examination of the stool, right? Because you're seeing this bloody stool, which is basically showing you damage. So when you see these acute appendicitis-like symptoms, that's actually most often associated in immunocompromised patients, and that's where you'll also get like a chronic enteric infection. I also mentioned here Guillain-Barré syndrome and Reiter's syndromes. Both Guillain-Barré and Reiter's have been associated with Campylobacter infection. So with Guillain-Barré, remember, this is technically an autoimmune disorder. So basically you have antibodies that are made to those lipooligosaccharides of the cell wall of C. jejuni, and they basically cross-react with nerves or receptors of the peripheral nervous system. Reiter's is actually a seronegative reactive arthritis, but it's also been associated with C. jejuni. It's basically associated with, it's one of the spondyloarthropathies. So the incidence of Campylobacter is actually relatively unknown. We don't really know how many cases, and that's pretty common. So anytime a disease is self-limited, then knowing the exact incidence is pretty difficult to determine. It's not a public health reportable disease. Surveys indicate that it has decreased in the last decade, probably due to better food handling techniques more than anything else. But it is still estimated that between 1.4 to 2 million people per year actually experience Campylobacter jejuni infections in the U.S. In the U.S., it's most commonly observed in infants and young children, with a second peak of disease typically in the 20 to 40-year-old age bracket. It's higher in developing countries with symptomatic disease in infants and young children, probably having to do with food handling techniques again and access to clean water. So how do we diagnose it? That's pretty easy. There's actually an immunoassay that is available that will detect either C. jejuni or a similar disease in the same genus, C. coli. Um, and when compared with culture, the sensitivity of this test is about 80 to 90%. So it's pretty accurate, and the specificity is greater than 95%. So it's pretty intrustable. Preventing it is actually pretty easy. Um, so really all you need to do is make sure that you've got proper food preparation. So it's normally self-limited, so it's not likely to cause some major epidemic. Should you have an immunocompromised patient or a patient that for some reason went bacteremic or septic, you could treat with erythromycin or azithromycin, but not normally an issue due to the self-limiting nature. So proper food preparation basically encompasses a lot of things. It certainly encompasses what we do in our own kitchens, right? Washing our hands, clean surfaces, making sure we have functional refrigerators, things like that. But there are also things that happen outside our kitchens that actually protect us, and some of that includes things like pasteurizing milk. So drink pasteurized milk, avoid unpasteurized milk. That seems like a no-brainer, not too difficult to do. I mean, you go to the store, you buy some milk, chances are it's pasteurized. Well, maybe, maybe not. Raw food diets are becoming a little bit more popular, especially uh, depending on where you practice. There are areas of the country where, farm to table and raw food is becoming more prized. And one of the places that that is true is with milk, cheese, and other dairy products. So actually in 2015 in West Virginia, a law was passed that basically made it legal to distribute, not sell, but distribute unpasteurized milk. Um, and they did this not necessarily out of a desire to drink unpasteurized milk, but more out of some libertarian desire to not impinge on people's rights. So it's legal to drink it, just not sell it. So to celebrate the signing of this, momentous law, the senators in the House basically brought in some raw milk to share with representative friends, and about 7 days later, many of the representatives fell ill with an acute gastroenteritis, self-limited, thankfully. Now, we can't be certain it was Campylobacter, right? Because many organisms can cause disease, and they are all found in, and are often found in raw milk. So it could have been any of the Enterobacteriaceae, E. coli, Salmonella, any of these, including Campylobacter, Listeria, parasites, lots of things. But I say this here because normally when you see a question stem saying soft cheese or unpasteurized milk or something along those lines, your inclination might be to think Listeria, and it might be, but there are other organisms like Campylobacter that might need to be considered, especially if you're dealing with a patient situation. So that is all I have on the Campylobacters.